Medication adherence in the UK is a massive problem, where we believe up to 50% of patients are not taking their medicines correctly. And this has two significant consequences. Firstly is just the wastage of medicine, where we estimate up to £300 million of medicines are wasted in the NHS every year. But more importantly is the human impact. What happens to patients when they don't take their medicines correctly? Well, their conditions get worse, and this has real consequences. Increased GP visits, increased hospital admissions, people getting worse, not better. This whole campaign is about a call for action, a call for the NHS, for doctors, pharmacists and nurses to start putting their heads together to start tackling this problem now.
At Omnicell, we really care about adherence. We've worked for over 20 years to help pharmacists and patients find the right solutions to help people take the right medication at the right time. Over 1 million people use our packs to help manage their medication regimes every day in the UK. Despite this, the impact of non-adherence in the UK is staggering. Hundreds of thousands of people die across Europe. It's a silent killer. Patients don't get better, and they don't feel well, and they don't stay well. This can have a devastating impact on friends, families, carers and support networks around them. On top of this, non-adherence costs the NHS millions of pounds every year. It impacts our GPs, our pharmacists, our nurses and our hospitals. Yet nobody talks about it, until now. We know we can't solve medication non-adherence on our own. The Let's Take Care of It campaign is the very start of the journey. This year we've had 3 very simple aims: to expose and reveal the true cost of medication non-adherence, to talk about it, to tell people about it, to educate and to raise awareness, and to share our passion about the issues and the impact of non-adherence. And finally, and most importantly, to get people from the healthcare community working together in collaboration to really make a difference. Here's our story so far.
One of the great things about this campaign is we got to meet the people behind the facts and figures, patients who tackle these issues day in, day out. People like Dave and Martin. Martin lives with HIV and a range of other health complications, which means he has to take up to 58 tablets every single day. As his carer, Dave could spend hours trying to sort Martin's medication out on a weekly basis. For them, using adherence solutions means better quality and longer life. We also met Lisa. Lisa was left with epilepsy and brain injuries following a serious car accident. She would often struggle to remember to take her medication, and on one occasion even ended up in hospital having accidentally overdosed. For her, using an adherence solution means leading a normal life. We also got to work with great charities like Parkinson's UK, who share our passion for tackling non-adherence. That's because as a patient with Parkinson's, just a few minutes can make a difference in terms of taking your medication.
Let's Take Care of It is just the very start of a journey. We need to build on these collaborations, grow a united voice and really set the agenda for change moving forward. We're really proud of the Let's Take Care of It campaign this year and proud to be part of Omnicell, improving healthcare for everyone.